Hi, my name is Birgit Hopkins. I am the Director of Athletic Training Program at Merrimack College, and this is Dennis Fontaine. He's our Clinical Education Coordinator, and we also have 3 students with us as well who are going to be able to answer some questions and give you some feedback on their experiences in the first year of the program. So first, I'd like to just tell you a little bit about our program. It's 80 credits. It's two years plus 1 summer, so you will start this summer in May. And the way that we set it up was we preloaded the courses so that you could get all of your clinical knowledge-based courses out of the way first, so that by the time you're into your into your second year, you're going to do a 10-week full immersion, and you'll have all of your skill component out of the way at that point, so that you can use all of the skills for athletic training in that clinical opportunity. Besides the courses, you'll be taking 5 clinical experiences, so you'll be taking 4 credit courses the whole 2.5 semesters that you're with us, and you'll also have 5 clinicals associated with that as well. Those clinicals are set up so at the very beginning you're learning a lot of skills, and the skill and knowledge that you're learning in the classroom, there's no learning over time. You're learning it, you're doing it, you're utilizing those skills in your clinical components each semester as you grow, so that by the time we get to that second year, you're able to use those skills as an athletic trainer so that you can really get some foundational knowledge and use those with your preceptors when you're on campus. So I'll let Dennis give you a little bit of our clinical overview, and then we'll let the students talk a little bit about their experiences.
So as Birgit said, all students in the program will take 5 clinicals, and we start your summer, the last 2 weeks of summer, with what we call a mini clinical, just exposing you to the athletic training room, typically at Merrimack College, but starting for you to utilize those skills that you learn in regards to taping, acute emergency care, wound care, blood, wound assessment, those types of skills. And then you come back in the fall, and our students were placed in a pediatric setting. We have 12 to 15 local high schools that we utilize. And you typically do about 150 to 200 clinical hours in that first experience. Moving to the spring of your first year, our students are now placed at a collegiate setting, able to use a little bit more skills, the tapings, fundamentals, evaluating injuries, and starting to put together treatment plans that consist of therapeutic modalities, therapeutic exercises. And then the big thing that we've added that fulfills the CATIE standards and guidelines is a 10-week full immersive experience. As Birgit mentioned, we front-loaded the courses to allow our students to basically use their knowledge, skills, and abilities in a 10-week, 40-hour plus immersion experience that typically starts around August 20th, and our students will come back October 22nd. Students can start early if they desire to, but those absolute dates typically fall around August 20th to October 22nd. After October 22nd, it will just be 8 weeks of classes. You've already fulfilled the clinical obligations, and most of the preceptors and clinical sites that I've talked to are pretty excited about that, to have a student there consistently to enhance the continuity of care so they can oversee a patient's progress, whether it's a rehab or a certain injury, so the students get a better insight into the profession as opposed to maybe just being there 3 days a week in an earlier experience. And that last experience, basically it's kind of the student's choice in terms of pediatric, collegiate. We're looking at some industrial settings, potentially in the Merrimack area with National Grid, and looking to expand our clinical opportunities for our students. And then that last experience is really aimed at getting our students ready to prepare for the BOC exam, which they can take in March, April exam. So it's really a lot of refining skills, getting them ready for the BOC exam, as well as entering clinical practice, resume development, and assist them in finding a job.
So that's basically us in a nutshell as far as classes go and the clinical experiences go, but we thought it would be nice for you to hear from 3 students that are starting, or actually in the middle of their 3rd semester basically, and why they picked Merrimack, what their classes have been like so far, and what their clinical experiences have been so far. So Shara?
Hi, my name is Shara Dowling, In the fall, I was at Lawrence Academy, which is a high school in Groton, Mass. It's a prep school, so I had a little bit of a different experience than everyone else. They had like a lot of great technology, and a lot of the athletes actually committed to schools like Boston College for football, which was really cool to get to work with athletes who were growing. In the spring, I'm at WPI currently. I went to Franklin Pierce University for my undergrad and got a degree in health science, and I chose Merrimack because of the commute. It was pretty close to home. I commute here every day. And so far, I really like our program. I really like the class size. There's only 10 of us, so we get a lot of hands-on experience, and we get to work with each other every day. And the teachers are also really great. We get a lot of attention from the teachers, so if we need help with anything, like there's always someone there to help us.
Do you think that your courses have set you up for your clinical experiences off campus?
I would say yes. Learning modalities and being able to use it more in the college setting than the high school setting was really good, because we learned modalities in the fall semester, and a lot of the high schools didn't really utilize modalities as much, but we were still learning at that time, and now in the college setting we can actually apply our skills. And I know a lot of the colleges use eSTEM and ultrasound and stuff.
My name is Rachel Zeiner. I went to Quinnipiac for my undergraduate degree in health science. In the fall, I was at Reading Memorial High School, which is about 20 minutes from Merrimack, and I absolutely loved it. It was a really comfortable setting. The kids are super friendly, and they really got to know the athletic trainer that's certified there, so she made it a really comfortable environment for me and a great learning experience for me. For this spring, for my clinical, I'm at Harvard University in Cambridge, and that experience has been unbelievable. I'm truly fortunate to be there. Their technology that they have there is top in the world. They have an AlterG, which is like an anti-gravity treadmill. They have all the modalities that we've learned in class, so I can really bring my knowledge there and utilize them. They do so much manual therapy, which is really different than high school, because you don't really have the time in high school to focus on doing massage and manipulation, where in college you can really take the time and do that for your athletes. And yeah, why I chose Merrimack, kind of like Shara, I live about 20 minutes away from here, so the commute is really easy for me. I like the feeling of a small school. And also, like Shara said, our class size is about 10 kids, so we really get the attention that we need, especially in a program that's very academically challenging and demanding. Having the teachers at our disposal anytime that we need them for questions is a real advantage that we have here.
Hi, I'm Kate. I did my undergrad at Salem State, where I got a degree in exercise science. I chose Merrimack because it's very close. I live in Salem currently, and I'm also able to work on the weekends, so I can actually pay for school by myself. What else? In the fall, I was at Essex Tech in Danvers, which is very close. I personally love the high school setting. You really get to see your athletes every day. Learned a lot of taping, wound care, not like the basics, but it was a good like starting ground for us. And then right now I'm at Tufts University in Medford, which is totally different. We use a lot more Therex and manual therapy again. So it's totally different from the high school setting, but I also like it. I'm learning a lot. And that's what
Question. So one of the questions is, what is the job placement like outside of the program? So what is that about?
Sure, and I think it's all dependent where and what students' interests are. The job opportunities out there typically are the pediatric patient population setting, high schools, clinics. I think in Massachusetts or in our area and beyond, you can find high schools that will employ an athletic trainer full-time. Typically, if it's an athletic trainer per se with a master's degree, they will put you at the same pay scale as a teacher with experience. Some PT clinics do athletic training outreach, where you may be in a PT clinic in the morning and then out at a high school in the afternoon. College settings are hiring, obviously with NCAA expanding roster sizes and the rate of concussions. I think more sites are looking to add on to their athletic training staff. I would say the majority of our students, will be professionally prepared to challenge the BOC exam, and it's, I think, geographically where you ultimately want to be across the country.
And I would say, just back to stats and stuff, looking at our Katie, who's our accrediting body, looking at our placements in the past couple of years, Merrimack with our undergraduate program of students that have applied and gone out to the job force, we're in the 80 percentile. We're 89% for the pass rate on the exam. Last year, in the past 3 years, we've been at that same place. And as far as job placement goes, our students who have applied for jobs and looked for jobs in the field of athletic training, it's been about 80% of them, 80 to 85% of them, they've all found jobs and they're all working at this point. So what would you say what sets Merrimack apart from other schools? Why don't you guys do that first, since you guys looked at other schools, and then we'll fill in what we think the answer is.
One of the huge things for me was the technology that we have here. I mean, our modalities are fantastic, and we also have a sim man, a simulation man, that we can program him to do any type of scenario, and we can learn from him. So we're not just practicing on healthy bodies like everyone in our class. We can practice on a sick patient as well. So that sim man is really a good tool for us to use. I think that is really one of the main advantages that we have here.
For me, I really liked the small school environment, because the undergrad school I went to, Franklin Pierce, was similar to this environment where we had small classroom sizes and the campus was like very easy to navigate. And also, I really liked the website. It was very informative for me, and I felt like it's met my expectations. Whereas other schools that I looked at, it was hard for me to find information about the programs because I wasn't sure if I would be living on campus or commuting.
I also looked at Bridgewater State, and personally, the commute was better to Merrimack, and it was actually more affordable, which was surprising as well.
And I would say from our perspective, being a new program in the master's world, our offices are basically, we're in our sports medicine lab right now. Our offices are upstairs on the 4th floor. We're pretty easily to get in touch with whenever you need to talk to somebody. We're invested in our students. We take pride in what our students do. We get mad at our students if they don't do what they're supposed to do, but we take pride in them, and we really get to know them, and we really build relationships as they become young professionals getting ready for the real world.
Yeah, I would just add, if you're looking for a curriculum that you want to be challenged and pushed to excel, then I would say this is the program for you. I think we're not only teaching to the BOC exam, but we're teaching our students to be appropriate clinicians when they graduate. So I would think that is an added plus to our program.
Yes, we don't think of just athletic training. We call athletic training healthcare professionals. And we're training you and preparing you to become healthcare professionals, working with doctors, dentists, whoever you need to work with as you go out into the future. So are you able to work? I think Kate already answered that a little bit, so go ahead, Kate.
Yeah, so I actually work at a bar on the weekends, and I'm able to pay half of it out of pocket, and then the other half I got Stafford loans, so which I feel are less loans because the interest is low. But it's also about balance between work and school. During the week it's school, during the weekend it's work, so I find a good balance between the two, and I'm able to do it myself.
And the way the curriculum is set up is your classes are Monday through Thursday. Your clinicals are usually afternoons. You can use Fridays for clinicals if you need. You can use weekends for clinicals as well. Besides that full immersion, you have Friday, Saturday, Sundays off from classes. So that actually gives you an opportunity if you choose to work, which is awesome. You guys have anything you guys have?
I also work. Over the summer, I found it kind of difficult because I was working almost full time at the Dollar Tree. So I would go to class in the morning and then to work, and then I would have to find time to do homework, and it was a struggle, but it is possible, and I did get used to it, and I ended up doing pretty well. And now I've kind of found that balance, and I've made my life a little bit easier, and I only work a couple days a week, but I also get a lot of help from my parents too. and loans.
And second year, you're not in summer classes. So when classes end the first week in May, you're done until your full immersion starts August 20th. So you have the opportunity to get a full-time job in the second year of the summer. Are there any internal funding opportunities like GAs or scholarships other than loans? Unfortunately, because of the clinical component, there are none. GA opportunities are for people that are already certified athletic trainers. Those are going to start to go away as athletic training moves toward the master's degree. I know that in the school itself, there are small scholarship opportunities, but most master's programs, especially for professional degrees, don't offer a lot of scholarship money. So we've done, I believe, as Merrimack College, a really good job in offering scholarships. If I've talked to some of my other peers, their programs, their schools don't have a lot of scholarship money associated with it, where Merrimack is really trying to balance that out. We're also balancing it out. If you really look at the credit count of 80 and you look at what other students are paying for their degree at Merrimack, our cost is $300 lower than what a credit would cost at the master's level. So I think Merrimack has done a good job of balancing out, because we have 80 credits, with making it a shorter dollar amount per credit. And then again, by offering some scholarship, I think the college is trying to be as fair as it possibly can be to make sure that people can be a part of this program as we move forward.
Final thoughts. I would say the big things for us are kind of looking at the curriculum and courses. We definitely just didn't change the BS and make it an MS. We have a team physician who is our medical director teaching in the curriculum. We added a intro to medical imaging course, as well as kind of what the future of athletic training looks like, educating students on suturing and other trending topics. We've also added a special topics in healthcare in the last semester, kind of looking at what's really changing and driving healthcare. So I would say, along with our curriculum, our listing of clinical sites, clinical opportunities, and the staff and the resources here, I think make Merrimack a good fit, or something that you really should think about and investigate more if you're looking to get your master's in athletic training.
And I would say off of that, before I get to that last question, I would say off of that, I feel like we've done a really good job in trying to see what else is out there, because we want to give you some additional certifications as well. So we're looking at kinesiotaping. We're looking at some other certifications out there that you could add to your resume as moving forward, that you could put on your resume that will make you a little bit stronger than the applicants coming from other institutions in the area that have athletic training. So our last question looks like another one came in. What if I'm missing one prereq? This is a new program to us. So what we've realized over the past year or so between us and admissions, that as things are moving forward, we really need to understand what these prereqs are and what we're trying to do. So we have made our prereqs preferred prereqs. Because that will give us a little bit of autonomy as an institution, that if you're a really strong candidate and you're missing one prereq, we may be able to look at your application and say, yes, you do belong here. So I would still apply. I would absolutely have a conversation with Alyssa to see what that looks like and what that one prereq is. Because we have students here right now that we're missing one prereq, or we're doing some different things and they're thriving in the program. So we're not turning people away for the sake of a nutrition course or something like that at this point. And if it is something that we think is a valuable valuable course, right? We may say you have to take that before the summer, while you're taking it, even though you're taking functional clinical anatomy. It's probably a bad example. But anyways, if you're missing one, I would still apply if you're a strong candidate. So, thank you.